Welcome to our strategic analysis of Providence Health and Services, as presented by Danielle Parker, Martin Pedersen, Stephanie Verla, Kevin Warnicki, and Keisha Weathers.
Providence Health and Services was founded by the Sisters of Providence, Montreal, 160 years ago. Blessed Mother Emily Gamlin founded the Sisters of Providence, Montreal in 1843. Mother Joseph and four sisters arrived in Fort Vancouver in 1856. They immediately began serving the poor by building schools, orphanages, and asylums. Mother Joseph Hospital was created in 1859. The sisters continued to build and expand up and down the Northwest, building hospitals and schools throughout. Day-to-day operations were handed over to lay people in 1979. In this presentation, we will begin examining Providence Health and Services. We will discuss their business strategy, organizational structure, management style, and control techniques. We'll analyze their strengths, weaknesses, opportunities, threats, and make performance recommendations based on change and innovation. Providence is a not-for-healthcare organization and is deeply tied to its mission statement, which stresses the need to care for the poor and the vulnerable with compassionate service. In 2015, Providence provided over $900 million in community benefits. Providence is the second largest not-for-healthcare organization on the West Coast and one of the largest employers in Washington and Oregon State. Providence Health and Services include 34 hospitals, 600 physician clinics, 22 long-term care facilities, 19 hospice and home health programs, and 693 supportive housing units in 14 locations. The health plan serves employees and other large employer groups covering over 500,000 members. They continue to grow and are constantly looking for partners in healthcare, as well as better ways to serve the community. They have recently completed an alliance with Swedish Health Services in Washington State. They are partnering with Peace Health in a community health project in Vancouver. They are partnering with Walgreens with an express care model. Providence is expanding its mental health care services. They are also interested in working with large employers in the area of telehealth. Providence Health and Services is positioning itself toward the future, looking for innovative ways to improve health outcomes and lower costs through partnerships with other organizations and advances in technology.
Providence has prided itself on making sure that the health care is simplified for everyone. By doing so, they have been able to create a strategic plan that has supported the health and well-being of each patient they've served. Providence has also created a promise that states, "Together, we answer the call of every person we serve. Know me, care for me, ease my way." By keeping this promise, they have been able to have healthier communities and create the 5 pillars, which consist of inspiring people, building relationships, alignment with clinicals and care teams, developing new care deliveries and iconic models. Their future goals are to make sure that all patients are the center and never left behind, easy access to important information that they need. We will never forget those who are poor and vulnerable, and our mission statement, vision, and values will remain consistent as we adapt to the changing world. Organizational structures. Over the past 10 years, Providence has kept up all the changes in the healthcare field. Vice President of Supply Chain Management, David Hunter, said that we are continuing to improve the quality and reduce the cost so that we can provide alternatives to patients for care outside of the hospital. Back in 1856, the community had a hard time meeting the basic needs, but Mother Joseph and her four sisters always kept in mind their most important statement. Because of that, they have created the first schools, hospitals, orphanage, and other institutes that will provide for the people in the community. Management styles. Doing the right thing right is something that Providence wants their employees to live by. The human resource encouraged their employees to report and concern of any issues that happen that doesn't follow the code of conduct. Providence professionals work closely with the human resource to ensure that every situation is resolved with the employees and the workplace. All of the employees and leadership have a certain responsibility that they have held to. For example, things like keeping information obtained at the Providence confidential, performing your job duties in accordance with all federal and state laws, ensuring that written policies are processed to your apartment, and last but not least, discipline action to resolve matters when necessary. Quality is something that Providence holds to a high degree. They believe that the healthcare should be followed by safe, timely, effective, and patients and families are center. Each one of these terms work hand in hand with the other in order to make sure that Providence is able to provide the best health care to everyone in their best interests.
A key strength for Providence Health and Services is their dominant market leading position. With revenues of $14.4 billion, Providence is one of the largest not-for-profit healthcare systems in the United States, as they either lease or own 34 facilities and employ over 82,000 employees. Providence offers a wide range of healthcare services that enable it to address and serve the various medical complaints from the weaker communities throughout Alaska, California, Montana, Oregon, and Washington State. In addition, Fitch Ratings assigned a AA rating to $71.1 million in Series 2015C revenue bonds to fund a Portland-based expansion. The AA rating outlook is considered very stable, as Fitch views Providence Health and Services as a top-tier company in terms of market share for each of its markets served. Providence extends its market dominance by providing a wide range of primary care, outpatient, inpatient, and home care services. They serve the healthcare needs relating to cancer, heart and vascular, transplants, orthopedics, women and children programs, long-term care and housing services, rehabilitation, and behavioral health. In addition, they specialize in hospice and palliative care services for those suffering with life-limiting illnesses. The dominant market position Providence holds has garnered them many accolades and recognitions throughout the year. In 2015, the Hospitals and Health Network magazine named Providence Health and Services third on their most wired listing for beds in hospitals having digitized information flow. Also in 2015, Forbes ranked them 153rd as America's best employer. Another pillar of strength is their inpatient services growth. Driven primarily by inpatient service volumes and breadth of solutions, Providence posted a 2015 fiscal year revenue increase of almost 16% that totaled $14.4 billion as compared to $12.5 billion in fiscal year 2014. Patient admissions increased 8.7% from 333,000 to 362,000 patients in 2015. The Medicaid sector also drove expansion to $6.4 billion in fiscal year 2015 from $5.3 billion versus prior year. Although posting significant revenue gains, Providence has several weaknesses that lie underneath the numbers. In November 2014, employees filed a class action lawsuit in federal court against the company, alleging it is using an unwarranted religious tax exemption clause to skirt a federal pension law. The lawsuit also deals with an ongoing employee pension dispute stemming from the Swedish Health Services affiliation they completed in 2012. These lawsuits and its potential regulatory outcomes may seek recovery of large and indeterminate amounts of financial reserves that may limit its future ongoing operations. The magnitude of these pending legal disputes may remain unknown for a substantial period of time before a resolution is decided. Although top-line revenue increased almost 16%, on-hand cash reserves declined 3.4% on a year-over-year basis, from $6 billion to $5.8 billion in 2015. In addition, and probably the most alarming, is the drop in days of cash on hand from 183 days at the end of 2014 to 159 days at the end of 2015, which is a decrease of 13%. Also, earnings before interest, depreciation, and amortization, also known as EBITDA, also declined 24% from $1.13 billion in 2014 to $864 million in 2015. Declining cash on hand balances can create a weak liquidity condition for Providence. This operating trend may signal a form of financial instability and additional risk to the creditors on the ability for Providence to meet its short-term obligations. The reduction in cash reserves may cause Providence to incur additional debt to finance acquisitions, capitalize on business opportunities and market conditions, meet existing capital expenditures committed, and postpone future expansion and equipment needs, which is detrimental to growth. The final weakness is the year-to-date labor expense, which increased 13.4% or $1 billion higher than prior year. Providence made strategic investments in moving to an institute's model of management that has driven total salary expense by 14% and total benefits expense by 11%. While at the same time, procurement pressures are on the rise, with the supply expense increasing 15.6%, which was in line with revenue growth, but the pharmaceutical expense, which is a supply expense component, increased almost 31%. Across the industry, healthcare facilities and providers are in various stages of incorporating the internet into their operations to allow new ways to communicate with the general public, specific patients, physicians, other providers, and employees. Notable web-based services include public websites, various telemedicine applications for targeted patient audiences, physician portals, physician educational sites, and facility intranets, which will serve an organization's internal audiences. The internet is also redefining communication channels between doctors and patients, as well as between healthcare providers and other healthcare-related agencies. Advances in home technology, coupled with the aging of the baby boomer generation, have created the demand for better communications with patients about their ongoing care and monitoring. Improving the communication between the patient's at-home technology and the provider's technology is also a growth opportunity. Other opportunities include resolving access to care barriers, development of clinical trial tests of new agents and combination of new agents, and new treatment strategies that can be designed, executed, and reported. The coming changes in healthcare reimbursement mechanisms will also create opportunities to add value and to be compensated for the quality and efficiency that are so valued by second and third-party payers. The forecasted shortage of trained oncologists is an opportunity to redesign care delivery models and reestablish what economists refer to as pricing power. Threats to our professional efforts may come from these same second and third-party payers, who will continue to press their desire to pay for less of the services we currently organize to deliver. The aging of the oncology workforce and the aging of the population threaten to overwhelm our current oncology care system. A potential threat, albeit one with a happy outcome, is that cancer will be cured with a simple measure or measures, and we will have little to do. The basic and clinical scientists with whom I speak tell me that this is unlikely, but let us work towards making this happy threat be realized.
When trying to figure out what needs to be changed or improved with a company, the best place to look is with former or current employees' reviews of the company. With Providence Health and Services, there were hundreds of these reviews. While most of them were great reviews where the employees really loved their job, the reviews that really need to be analyzed are the negative. All of these reviews are given either by former employees or current employees in various departments of the company. While some cannot be changed like everybody is so stuck up or there was drama in the different cliques, most of them can be changed. Some were simple grievances that could be solved with just getting their departments organized so items are easily found. Most of the complaints boil down to two main grievances: management problems and staffing shortages. Management problems are the most complained about thing for Providence Health and Services on Indeed.com. This could be solved in a couple of ways. There could be a new management training program that would help clear up some of the grievances about the management taking sides or not being there for their employees. This would also make sure that all of the managers are trained the same. New training programs can be expensive, so a lower cost solution would be an afternoon seminar for the management team. This could give a really quick breakdown of what management is actually accountable for and how to handle employees. The second problem that employees stated was staffing issues. Some employees didn't have time to take a complete break, and others didn't get to take a lunch. This also could be solved in a couple of ways. Providence could hire a few more part-time people to ensure there is enough staffing. This is usually the most expensive route, and it might not be as effective as hoped. The alternative is to make sure that the scheduling is done correctly. This would ensure the proper amount of staffing would be available for the times that they might be busy. Some other things that might be something to look at would be some reward programs. Something as simple as a company-wide potluck or barbecue to show employee appreciation can go a long way to boost company morale. There could be goals, friendly competitions, and rewards set up for each department or for each building to complete for certain rewards. This could be something silly, such as the person with the most high fives in one day getting a special parking spot for a week. It could also be something more serious, such as the hospital with the highest patient satisfaction gets gift certificates for the employees to have a nice lunch. Benefits are really important for everyone. Sometimes it is the determining factor on why people stay employed at certain places. Providence Health and Services has a decent health care plan that is extended to all employees that have been employed either full or part-time, maintaining at least 24 hours per week, and have been with the company for more than 3 months. This might be something that can be changed for company improvement. Benefits could be extended to everyone that is employed once they become a member of the Providence team. This could also be extended to people that have retired from the company, since sometimes retirement benefits are not that great. Another great idea for innovation that can be looked at is community outreach programs. This would allow needed doctor consultations for people that might not be able to afford to go to the doctor or get the wellness exams they need. People in rural communities that might not be able to make it to a city center every day would be able to get the help they need as well. Future changes should be made with several other aspects of the company as our civilization advances. Lowering costs, both for the hospitals and the patients, should be considered. Improving communications and advances in technology are some things that need to change as technology changes. As always, quality of care for the patients and their families should be examined regularly to make sure the best care is being provided.
Providence faces many challenges. It has ongoing legal concerns that while these issues may not have a severe effect on the organization's finances, they could have a significant effect on the company's image and reputation. In the short term, Providence must pay close attention to its cash reserves. As new people are introduced to the healthcare system due to the Affordable Care Act, the company's revenue and reimbursement rate will continue to fall. Many of these consumers are individuals who could not get insurance before because of pre-existing conditions. These patients will need more acute care at first and less over time, so the cost of their care will still stabilize. An older population will also present unique challenges for the hospital. In August of this year, Providence signed a letter of intent to merge with St. Joseph Healthcare. The combined entity, Providence St. Joseph Health, will include 16 St. Joseph hospitals and 34 Providence hospitals. St. Joseph is a healthcare system primarily in California and also West Texas. They have similar missions and values, so the company should be able to integrate their cultures successfully. It is too soon to know how exactly this will affect both organizations, but the need for both systems to do so speaks to the issues in this presentation. Specifically, an increased focus on mental health is a priority for both entities and a condition for approval included by the Attorney General of California. Increased buying power and ultimately deeper cash reserves are also a goal for the merger to be successful. Providence does occupy a strong position in the marketplace, but it must continue to innovate. It is a tumultuous time for all healthcare organizations as they adjust from a pay-for-service to a pay-for-outcome business model. We have looked at how Providence is attempting to navigate this new terrain. Many of the measures we have touched on are meant to address this new financial reality. Providence believes that they must increase quality while lowering costs. Their goal is to reduce readmission rates, increase preventative care, eliminate unnecessary procedures, and make sure that consumers are delivered the right kind of care at the right time and in a way that works for them. Advances in technology, telehealth, and improvements in hiring practices, supply chain, home care management, training at all levels, and finding like-minded partners are all ways that Providence is looking to meet its strategic goals while remaining true to its roots and its mission.